Hi, I'm Vijaya. I will be demonstrating a session for a group of empty nesters to handle their anxious thoughts and for emotional regulation. We will explore how to address these issues using mindfulness interventions. Who are empty nesters? Empty nesters are parents whose children have grown up and moved out of the family home to attend college or start their own lives. Many experience a sense of emptiness due to the loneliness of a quiet house. This transition often leads to significant lifestyle changes and can evoke a mix of emotions, including both a sense of loss and newfound freedom, often described as bittersweet experience. According to 2020 census, there are 22.5 million empty nesters in the United States between the ages of 40 and 60. While not all parents and caregivers develop emptiness syndrome, those who develop arises from a long-term maladaptive responses which were not attended to. Emptiness syndrome is a psychological condition that occurs when children leave home. It arises because parents, caregivers often struggle with the sudden change in daily routine, loss of purpose, and increased isolation, contributing to anxious thoughts and sense of emptiness. If unattended, it develops into emptiness syndrome, which leads to mental health problems when the anxious thoughts and feelings become overwhelming and persistent over a period of time. This can result in conditions such as depression and anxiety disorders. Additionally, individuals may engage in negative behaviors like substance abuse as a way to cope with their emotional distress. This risk increases if the person already has a history of mental health issues or lack of support system. Mindfulness can be a powerful tool for empty nesters to care for themselves and navigate this life transition with greater ease and well being. It involves focusing attention on the present moment, free of judgment, and accepting the thoughts and feelings with curiosity. It encourages exploring sensations with awareness and addressing anxious thoughts using mindfulness interventions like five finger breathing and five senses breathing. Five finger breathing is a multisensory technique that encourages more than just focusing on our breath. It involves concentrating on the movement and sensation as one hand touches another deliberately and slowly. This promotes self regulation skills and facilitates the brain's entry into a state of deep relaxation, leading to the release of endorphins. This practice brings peace, calm, and even pain relief, aiding in becoming aware of our thoughts and calming ourselves. The other intervention is the five senses breathing exercise, also known as 5-4-3-2-1 breathing exercise. It is a grounding technique often used to manage anxious thoughts and bring ourselves into the present moment, that is, here and now, in any situation, anywhere. All that is needed is to notice something you are experiencing with each of the five senses. By allowing life transitions to promote self care and well being, mindfulness helps individuals navigate changes with greater acceptance, ease, and resilience. Now, let's practice five finger breathing. Sit comfortably with your back straight. Place your hand in front of you with your fingers spread wide apart. Use the index finger of your opposite hand as a tracer. Place the tracer finger at the base of your thumb as a starting point. Breathe in slowly through your nose. Raise up the side of your thumb to the tip. Now, as you breathe out slowly through your mouth, trace down the other side of your thumb. Move to your next finger and repeat. Breathing in as you trace up and out as you trace down. Focus on your breath and the sensation of the moving finger. Go at your own pace and complete all 5 fingers. Now, reflect to notice how you feel. Repeat if you like. You can use this technique whenever you need a quick way to calm yourself when you notice anxious thoughts surfacing in your mind. Now that we have calmed the mind, let's bring it into the present moment through another powerful mindful technique, the 5 senses breathing exercise. All that is needed is to notice something you are experiencing with each of the 5 senses. Now, let's do it. The 5 senses breathing exercise together. Find a comfortable seat, or you can also stand. Take some deep breaths to settle in. Name 5 things you can see. Name 4 things you can touch. Name 3 things you can hear. Name 2 things you can smell. Name 1 thing you can taste. This is a quick and relatively easy exercise to bring ourselves into the mindful present moment here and now. Keeping a quiet mind can be rather challenging, and thoughts will often pop up. The idea is not to block them, but rather to let them come into your mind and then disappear again. Whenever you need, spare a minute or two. Assume a comfortable posture. Bring your attention to the surfacing anxious thoughts, accept them. With awareness, address them with the powerful mindful interventions we practice now. Let them pass by, allowing yourself to tune in into your current state. Remember the 5 A's: attention, acceptance, awareness, address, and allow. Thank you.